Hi guys, Dr. Lavan again. So now we're going to be talking about the back, which we've got Rachel here nicely modelling for us. So Rachel, do you want to run through what kind of injuries or things we can do for the back?
Sure, so I'm sure everybody's had a back injury in their life. Everybody's probably suffered from back pain in their life. This is a model of the lower back here, so the arch of your spine and then going down into your coccyx bone. We can get lower back pain through lots of different ways. You may have lifted something very heavy. You may have been doing some exercise. Lots of people's back pains come on for different reasons. Now, it's important to remember in the acute stages, so very early on, that our body, we naturally try and tense up and keep ourselves as safe as possible. Lots of people like to lie down or sit down to rest their back. Now, whilst this is okay to do for half an hour or so, it's important to remember you don't stay sitting or lying down for long periods of time if you're suffering from back pain. This can cause other issues. It can cause other joints to become, let's say, unhappy. It can cause you a lot more problems in the long term. So despite having the pain, it's good to gently move around.
Great. And in terms of kind of medication, because commonly we get patients who will call up saying, my back pain's playing out, do I take medication, do I not take medication? I mean, I guess as GPs we will always try and avoid taking medication if we can, but is there benefit taking these kind of anti-inflammatories and painkillers?
Sure, so everybody feels pain differently. Pain is a funny concept. Something that I might be able to deal with, you might not be able to deal with. It's important to be sensible with our pain medication, make sure we read the packaging and take sensible amounts. So to keep your pain levels low, it might be worth alternating between paracetamol and ibuprofen every 2 hours. That way your pain should be kept low rather than having a dip taking the paracetamol and ibuprofen together every 4 hours.
Great. And I take it, obviously, exercises, you were saying kind of light mobilization. What stage? I mean, would that be kind of in the first day or so, or would we kind of relax a little bit maybe for a week?
No, so a week can be too long. So obviously an hour after you feel your back twinge or whatever, fine, take a breather, have a seat. But we want to continue about our daily life as much as possible. It's important that with general or kind of minor back injuries, pain doesn't equal damage. The pain you feel, people often think means, oh, I'm making my back worse. It's just your body's response and you're slowly kind of healing over time and you need to keep moving gently. So whether that's gently pottering around the house, going for a 30-minute walk, it might be painful, but in the long term, it's more beneficial for you.
We've spoken about back pain and what things we can do in terms of medication. There's obviously cases where patients may find, gosh, something is quite worrying going on here. So what are the kind of worrying signs that we need to look for when it comes to the back?
Sure, very important. So obviously pain can be quite scary for some people, but it's a very natural process. What we worry about with back pain is if you were to have any episodes of incontinence.
Okay.
So whether that's suddenly wetting yourself or finding you've soiled yourself as well. Okay. It might sound funny with back pain, but all the nerves are connected. The nerves that come out the spine, they do run down to other areas, and if you have any episodes of incontinence, whether it's bladder or bowel, you need to seek medical advice immediately. Other things as well, any numbness or tingling down your legs or in your genital region can be a sign of a more worrying pathology that's going on, and you need to seek advice immediately. Lots of people like to say, oh, I slipped a disc in my back. The discs here are these in between the bone, these squidgy bits here. It's worth noting that these discs, they can't slip. They physically cannot slip. We need to get rid of the terminology slip disc, because discs have never slipped. They never will. Discs herniate or they bulge. So the terminology to use if you think you've got a slip disc, not that phrase, it's a bulging disc or a herniated disc. An exercise you can do that helps with your back pain is a cat and a camel curl. Sort of like it sounds. Danielle's going to arch her back here, really stretching out the muscles that go down here. And then she's going to go into her cat curl, raising her chin and arching her spine that way. And then you can go back into your camel, perfect, and then down into your cat. Another stretch we can do for our lower back is rocking our knees gently from side to side. So if Danielle shows us now, she's going to gently rock her knees all the way to the right, as far as they will go. Don't push yourself. If you experience too much pain, do stop. She wants to experience a nice stretch through her back. She'll come back up to the middle with her knees, and she'll repeat over the other side.